I'm Elmer Linboom, a medical doctor with Aurora here in Manitowoc County. I do family practice, outpatient only. The beginning of it is the same process as a regular office visit. You call the clinic and you can decide before you call that you're calling for a video visit, or you're given that as an option. And if you decide that as an option, your first time you get walked through it with a packet from Aurora via electronic, and that's how you can get set up with this. You need a smartphone or a PC with a camera on it, and so they'll find a spot for you that's set aside for video visits. The provider's schedules are not yet set up to have any time of day be a video visit. There's certain slots that each provider has that they've designated for video visit time slots, because they can take a little bit longer sometimes than the ones in the clinic, or even they can be quite a bit shorter too. So there's set slots allowed for that. When you actually get the appointment, it'll come up on the provider's schedule as a video visit, so the provider knows that that's a video visit and not a regular office visit. So, you know, there's a little bit different preparation from the provider side and also the clinic side. Specifically, the check-in process with the rooming nurse, they still will call you and talk to you about your medications and allergies and maybe what kind of wellness topics you might be due for, immunization, screening, and then they will kind of get off of the connection, and then you're checked into kind of like a virtual area. It's done via Zoom for the most part, and then it flags on the provider's screen that you're ready to go, and the provider can click in there and enter the encounter that way. And there's a video feed and an audio feed. So there are more appropriate types of office visit that fit better with a video conference or a video visit. We see a lot of patients with mood problems, anxiety, depression, those type of issues, and even in the beginning, if you're first seeing a patient for the first time, those would be a good video visit to do. Or follow-ups. If you have somebody that you've seen in the clinic for this or that and you just want to have a quick follow-up with them and they'd rather not come back to the clinic, you can hook them up on video and say, you know, how's that medication working out for you? Oh, okay, pretty good. Then maybe we should keep going with you on that, or maybe we should try something else. Stuff that probably isn't good for the video visit would be like things where you need to have a physical exam to kind of diagnose and treat. Things like rashes, certain you know, chest pain, shortness of breath, some of the things like that where you really need to get the patient in and put your hands on them. Take vital signs too, because we don't have the option to do vital signs as of yet. There is a possibility that we can get some technology in the future where a patient might be able to measure at least a portion of their vital signs with some maybe gear that Aurora sends them, or that type of thing. But for right now, we aren't able to do that. So things that would need a doctor or a nurse practitioner or a PA to really put their eyes on something 3D, those might not be really appropriate for the video visit. It is secure. You know, there's a question with that with something like Zoom, but Aurora has security in place that it's just as private as an office visit.